student at the University of South Alabama, and today I will be performing trach suctioning and care. And so first, I need to verify my patient order, and so we have, it says suction tracheostomy as needed. So we have the order, and then I will need to verify hospital policy, and then I need to check the expiration date of my saline, and it is 12/21, so it is not expired. And so then I will need to position my trash can and then perform hand hygiene. And now I need to identify my patient with two identifiers. So we have Jaguar Jones, date of birth 8/25/1963, date of birth 8/25/1963. He has an allergy to aspirin, and he is also wearing his armband with an allergy to aspirin. At this time, I would need to explain the procedure to my patient and provide him with privacy. So now I need to raise my bed to a working height. And lower my side rails. And elevate the bed to 30 degrees, 30 to 45 degrees. Okay, and so now I will need to don my PPE. So first is the gown, which I am already wearing, and then next is the mask, which I am also already wearing, then my goggles, and last is my gloves. So now I will need to perform a respiratory assessment on my patient to check for the need to suction. Okay, and so for reasons that I might see that would give me reason to suction would be drooling, nasal secretions, crackles, or a cough when they cannot clear the airway. And so next I need to check the patient's vital signs for any signs of hypoxia or hypercapnia. And so four things I should be aware of when assessing that would be anxiety, restlessness, a decrease in pulse oximetry, or an increase in heart rate or pulse rate. And so now I need to put the pulse oximeter on my patient, and I will leave that there for the remainder of the procedure. And so now I will place the towel over my patient. And then I need to set my suction to 100 to 150 degrees millimeters Hg, being sure not to exceed 180. And then I will need to set my oxygen to 100% FiO2. And so now I will open my suction catheter kit and then remove my gloves. And then now I need to apply my sterile gloves. so now I need to remove my sterile water and check that expiration. So it expires in 2022, so it is in date. I'll remove my cap, drop it, and then now I need to remove my suction catheter and replace the sterile water. And so at this point, I need to attach the suction catheter to the suction. So I will get that. Now this hand is contaminated. Okay. Now I need to test my suction. And it is suctioning. Okay, and so now I need to hyperoxygenate my patient after removing the O2. So I will hyperoxygenate 5 to 6 breaths over 30 seconds. Okay, now I will insert the catheter until I reach resistance or the patient coughs, and pull back a centimeter, and then suction, and then I will clean it. And as I'm suctioning, if the patient drops above or below 20 beats per minute of pulse rate, or the oxygen falls below 90% or 5% below baseline, I would need to stop suctioning immediately. And so now you should leave 1 minute between passes. And so now I'm going to hyperoxygenate the patient a second time. 5 to 6 breaths over 30 seconds. And then I will suction again. Meet resistance, and then suction. And then rinse it out. And then at this point, I would check to see if the patient, or assess to see if the patient would need to have any more suctioning done, and then I would return later to do so if needed. And so lastly, I will hyperoxygenate again. Five to 6 breaths over 30 seconds. Then replace my O2. And so now I can remove So now I'm going to remove my sterile gloves. And then I will perform hand hygiene and then put on new gloves. And then complete a second respiratory assessment. have my care kit. And so now I need to open my care kit, grab the sterile field, place it on the table, and I will dump my supplies out. Now I need to get the saline and fill up each container. Okay, so now I need to remove the inner cannula. And drop it in the container. And then I will remove these gloves and don my sterile ones. Okay, and so now I'm going to organize my supplies on my sterile field. Okay, so now I'm going to get my inner cannula and my brush, and I'm going to come over here, over my dirty glove package, and clean the inside and the outside. And then place it in the trash and my inner cannula in there. And then now I need to dry my inner cannula. So I will get my pipe cleaners. And I'm going to push them through. And drop them. And grab a gauze. And dry the outside. And so now I need to replace the inner cannula. Here's the snap. And then I should have removed my drain sponge when I removed the inner cannula, but I accidentally forgot, so I'm going to go ahead and do so now. And so now I need to dip my cotton swab in the saline, and I'm going to clean under. And drop that, and then get another one, clean above, and I went under and then above, and I went from closest to the faceplate outward and cleaned in a big smiley face motion. And then while I was doing so, I was assessing around the faceplate. I was assessing under it, under the trach ties, to check for any skin breakdown, such as drainage or erythema or any other discolorations. And so now I'm going to clean the faceplate. And then I'm going to dry the faceplate. And then I need to replace the ties. So I get 1 inch shorter than the other. And I'm gonna grab my hemostats. And then at this time, I would tie my ties in a double knot, making sure that it is 1 finger loose and 2 fingers tight. 2 fingers snug. And I will be sure to avoid the carotid artery. And then I will cut the old ties off. So I can actually remove these, and it's Velcro. Okay, and so I would remove the old ties, and then I will replace the drain pad. And replace my oxygen therapy. And so at this time, the cleaning process is done. And so I will remove my gloves. And perform hand hygiene. Put on a clean pair of gloves. Do another respiratory assessment. And then I need to perform oral care. And throw that away. And then at this time, I would turn off the suction. I would turn off the oxygen. I will remove the towel from the patient's chest. I will raise the bed to a working height. Lower the bed. All the way down. Raise the side rails. And actually, I'm supposed to reach one down. And put the patient at 30 degrees. And then I would go to I will remove my gloves, perform hand hygiene, and then go to document. And what I will document is what the appearance of the secretions. I will document the patient's reaction or how they handled the procedure. I will document each respiratory assessment, and I will also document the trach size and type, and the appearance of the stoma and its surrounding skin. And that completes my trach care and suctioning checkoff.